My name is Jason Vallejos. I'm the Executive Vice President of Syndicated Insurance Agency. I've been licensed to do Medicare since 1998, and my agency has been in business since 2003. So we've been in this space for a very long time. A lot of technology supporting our agents. For many, many years, I've done business with a lot of the major executives and owners of major IPAs, all the insurance companies, but no matter how much wine and dining I do with my buddies that are the top executives of all the medical groups and all the insurance companies, I always have to go down to grassroots and work with the people that are on the front line. I have to always at least write an app once in a while, because once you forget to write an application, you are getting disconnected from that audience. So I wanted to bring people that are actually in the front line, working with the patients, the people that we serve. We are a full-service insurance agency, so we do estate planning, long-term care, you name it, workers' comp, commercial, malpractice. So if this was an estate planning session, I would have my team of estate planners. I would have an attorney, a CPA, and a financial advisor here, right? So keep in mind that when you're enrolling a member, it's not just you, it's a collaboration of pieces that are meant to service this person. We have to find the win-win on how to service these members. So we don't do street enrollment. We don't pick up people off the street and try to enroll them and put them with a provider. What we do is we support as a white label marketer to the provider, for the provider and the medical group to promote themselves, give them groupies to follow them. And as the traffic comes in, we have that trusted loyalty that whenever a member is Medicare eligible, it's going to be bounced back to us. And we'll do the rest of the enrollment, the education. We're a national agency, but most of our agents are in the state of California. And we love the Joe Namath commercials. We love you name it, all those commercials, because what happens is we come in and we clean up where they messed up. They put them with the wrong provider, the wrong IPA. They have no relationship with that person that they enrolled. So 3 months later, we're the ones that clean up the mess and enroll them where they're supposed to be. So today we're gonna talk about changing that way of doing business and engaging the community. So with no further ado, I'm gonna let Dr. DV introduce himself.
Hello, everybody. My name is Dr. DV Dushyant Vishwanathan. I shorten it, my initials. I am Chief Medical Officer of Columbia Center for Integrative Medicine. We offer hospital, home-based, and office-based services in Maryland and in LA County. And I'm a holistic doctor. I'm integrative medicine. So like 10 years ago, I wasn't feeling the insurance game. You know, it was just, we're not businessmen, like coming out of medical school, coming out of residency. It's just not intuitive for us to think in that way. It's a learning curve for doctors to learn to understand the insurance industry and to understand the value of the work that you guys do. How many people here feel like the doctors they work with don't really understand the value of you guys? Yeah, I didn't either, and especially, coming out of medical, finishing my training, I just want to be with the patients directly. That's where I shine. That's why I got into it in the first place. But the reality is that we live in a system that must include all of us to work together to serve the patients. And in the mornings I do hospital rounds, and often I'm serving patients who are homeless, underprivileged. They have insurance, but they really have nothing else, often, off the street. We also have a concierge service, so I'm also seeing even billionaires on the same day. Finding the right solution for that particular patient in that time is my skill set. We do a lot of functional integrative medicine, endocrinology. My unique clinical contribution is connecting the gut microbiome with the endocrine system. Working with Jason has just been an amazing experience, and with Vanessa, and we'd like to share what we do together with you today. Thank you.
Great intro. Thank you. Vanessa, she is a good. So we're all friends because I mix business with pleasure, because you can't separate yourself when you're working with people. So we know each other personally and in business, and I brought my friends to come and speak, and I can say that Vanessa is someone that we work with, and we have a great time working together, and she's representing Optum, and please feel free to introduce yourself.
Thank you, Jason. Hi, everyone. Good afternoon. Garibay, IPA Growth Manager for Optum in the LA Northwest region. I work for the, sorry, excuse me, a little nervous. So I basically work to grow the IPA network for Optum. I used to support the group models, the staff models, the employed doctors, employed staff. However, now I'm focusing on the IPA side of the business and working with doctors such as DV and great agents such as Jason. We primarily focus on growing the senior membership by grassroots marketing, like Jason mentioned, boots on the ground, a lot of education, a lot of great collaborations with agencies and agents, payer partners, of course. But I think the winning formula is really when you have all three parties on the same page, and most importantly, the doctor also buying into that strategy. So really working together to build a senior population for our providers in the area. I've been in the industry for 7 years. Honestly, did not think I'd be in the healthcare industry. I was actually studying social work at Cal State LA, transferred over to marketing. And I think healthcare is really the merge of both worlds. So I'm really happy with what I'm doing. I love servicing our senior members and working with great doctors and agencies. So thank you.
Thank you. And we love working with you also. Thank you. So just to get down to business, with the pandemic, Dr. DV, have you seen some things that have helped with your business, issues that weren't before? Of course, you're in the business of treating people and healing. Why don't we talk a little bit about telemedicine, what telemedicine is doing for...
Yeah, I'm really happy that Medicare sort of made telemedicine billing kind of comparable to office billing, because it really changed everything for me. I had my army of nurses going into homes for sick patients who were too scared to go to the hospital, too scared to leave their home during like 2020 from then onwards, and I was treating COVID in people's homes. I think home health is a very underutilized service, and we have a hospice service on both coasts. There's a very useful aspect of home health if you connect it with doctors. It's one of my major interests in talking to payers and to IPAs about expanding home health services. Also, it led to feeding the IPA also, feeding my IPA patient base, because the patients often were, they didn't know their primary care doctor, they didn't understand how the system worked. And in downtown LA and in East LA, in that area, there's sort of one major company, many of you know, that dominates that market, and often they don't really deliver exactly on the best quality care. So we were able to really get people connected to people like Jason and Vanessa to get them into the right system. And once you get into an IPA, I love it because you get care plans and so on. So it was like a domino effect, like getting the home health, my nurses going in, we doing treatment, offering care for COVID, and then them getting to know me, and then getting introduced to a new IPA plan and new insurance, and it opened doors for them, and it changed their lives. And then they would spread like a word of mouth to their neighbors and their friends. And these are poor Latino communities and African American communities in downtown LA. I really felt like me and my nurses and I really helped a lot of people, and you know, it was a heart-rending experience, actually, as many of you know what COVID was.
And Vanessa, they're talking about, in the previous session, a little bit about what the expectations are with brokers. We generate reports for your IPA, and maybe you can talk a little bit about how important it is about getting data of how your growth is going, and how that helps with Optum's agenda of growth.
Thank you. And actually, just before that, I wanted to touch on I'm sorry, nervous again. But the importance of working with brokers, really what we want to do is work with brokers that are ethical and compliant. Of course, reporting is extremely important. Optum was formerly Healthcare Partners, but now that we're under the Optum umbrella, of course, reporting is extremely important. We want to make sure that our agencies are supporting our seniors and enrolling them into the proper plan for them, Medicare Advantage plan for them. And it's really key for us to understand what they're bringing to the table, so we can move further with collaboration collaborations, strategy building, and actually funding agencies that are actually producing for Optum.
Tell us a little bit about Optum and where the position of Optum is in the market today.
Optum's huge, actually. So we're the nation's largest medical group, 4.5 stars, all across the nation. We're constantly acquiring new practices. Actually, we just acquired a new practice in Northern California. I think it was in San Jose. So we're constantly growing. And obviously, we have Optum Care and Optum RX under the UHG umbrella. So cousins with UHC as well. But yeah, huge company, great company to work for.
And Dr. David, if you can share a little bit about some of your approach that you bring to the patient that's a little different. There's a lot of skills that you have that bring alternative lifestyles. One thing to also point out, we work in multiple communities, and there are some things that people have taboos to talk about, but there's coverages that are now being covered. For example, acupuncture. That used to, it was such a taboo over acupuncture. Now Medicare, it's a mandate. If someone requests acupuncture, you can use acupuncture. And I used to be very skeptic about acupuncture. And we're seeing that that's really working for those people that were having opioids issues. I don't know if you can share a little bit about your approach to alternative health with your, and of course you're an MD, so you're talking about Western typical medicine.
Yeah. So integrative medicine, there's an integrative medicine, is everybody familiar with that term, integrative medicine? So they used to call it, I guess there was a term, alternative medicine, which is, I guess, an alternative to drugs and surgery. Integrative is you put it all together, see what's right for the patient. Some people need a medication for this particular problem. Some people need peppermint tea, for example. And there's a role for everything. And as long as everything's evidence-based, it's par for course. Integrative medicine has been shown to save money. In fact, to the point that one of the new contracts that we are getting, my company is getting, is a palliative care contract with a major hospital network in LA. And I'm not boarded in palliative medicine, but it was understood, the Kaiser data show that palliative care will lower costs by $4,000 per patient. So my interest in finding the right solution for that particular patient ends up making the places we work for, like hospitals and retention for home health agencies, we end up making them a lot more money, which ends up putting me in charge of utilization management and for hospitals as part of my work with hospitals. So I've learned about what everybody in the game, what they need, whether you're a hospital administrator, whether you are the patient, obviously, or every person in the game, what do they need the most? Like hospitals, for example, they want patients in, they want patients out. They want patient satisfaction scores higher. So that's one of the unique things about integrative medicine. It's not just one size fits all, it's custom care. I mean, my integrative patients get 90 minutes per consult, so we're not missing any data or details about the patients. My integrative patients, they're not getting no new heart attack, stroke, or dementia in 10 years that are doing this kind of work. And it's a compassionate way of looking at the humanity of the person, right? Not just a disease. A lot of people think that disease is a thing they have, like, I have this water bottle in my hand, I have lupus. It's not a thing to own. It's a dysfunction of your physiology. And if you understand your physiology is a dynamic process that can go in and out of balance, people get empowered by that. So for me, integrative medicine has been sort of the resuscitation of a broken system. How many people know what the third leading cause of death in this country is? The medical system, okay? Doctors. Now, it doesn't mean it's malpractice. It just means that the system is deadly, right? And so, back in the 90s, I think even 40% of patients were using some sort of alternative medicine of some kind. And we have thousands of years of data in China and India, these old systems that worked. Even the lifespan, longevity, lifespan, the avoidance of chronic disease, these things were well documented by our ancestors. So the idea of bringing in this kind of sort of traditional knowledge into modern medicine, it's a no-brainer, right? We know we can't fix everything with drugs and surgery, but I do round in an ICU every morning, so I know the value of drugs and surgery, but it's not the right fit for everybody at every moment.
And that's the way we should also look at it when we're working with patients. Not every single product that you have is a good fit. There's a lot, in my job, since we've been in business so long, I probably say no to providers wanting to work with us more than I say yes. So I already have a count of how many providers we work with, because what I do before we commit to helping a member enroll, we go check out their office, we go check out their staff, and if I need a tetanus shot on the way out, I'm not gonna be sending a piece of business over there. We're looking for retention. We're looking that if I see a disenrollment in the future, is because unfortunately someone passed away. I don't want them disenrolling because we put them with the wrong partner. So that's why I go in great details of walking and trying to talk what doctors do without having to practice medicine. But get involved, educate yourself, learn about all these different ways to treat patients, because we use the word member, client, customer. Start using the word patient. Trust me, the way you think is a little different when you say that's a patient of mine. Because we're also being health practitioners at the same time. We're getting HRAs, right? Health risk assessments. We're getting prescriptions. We're getting who's their specialist and trying to marry them to the right medical group. You're basically virtually writing the intake before you actually put the patient with their doctor. So become a healthcare practitioner. Try to learn a little bit of what's hot in healthcare. And what do you think about that, Vanessa, when it comes to working with providers? What does Optum look at as a good fit for a provider?
Well, we actually have a process to compliantly support doctors financially. So we have an IPA provider profile scorecard that basically rates our doctors based on different qualifying indicators. Maybe it's their honest opportunity, which we consider T65s and working beneficiary. If they have a high population, that automatically elevates them as a high growth provider. We like to go ahead and educate the provider and staff on the conversion opportunity for that. Of course, it's great for the patients, getting educated and hopping onto a Medicare Advantage plan, but also on the flip side, it's great for the provider from a financial perspective. Lost my train of thought there. But yeah, so no, and another way is obviously their contract types. So if they're long-term exclusive, semi, those are the doctors we typically support. And also great quality doctors like Dr. DV. We want to make sure that our patients are getting serviced properly by their provider and staying with Optum. Because with growth, we want to make sure we're also retaining our members.
Yeah, and there's something that I get feedback from Optum, and it's a culture of your organization. One thing that you always mention is if it's not the right fit, right? You don't want everybody. You just want who's a good fit with your structure.
Right. I mean, we understand if a patient is tied to a specialty that is not with Optum, of course, we want to work with agents that are going to do the right thing for their clients.
Yeah. There's always a moral dilemma when you're doing an enrollment. You want to make sure that it's always absolutely tailored to that person. You're customizing that care. So, Dr. DV, tell us a little bit about your I was interested to hear more about your endocrinology side. And the things that you're seeing. You know, we work a lot with chronic condition plans, diabetes, CHF. That's our typical enrollment. Almost everyone we work with. The statistics sound a little bigger, but almost every other call we get is someone with some sort of chronic condition. Can you elaborate a little bit on that?
Yeah, it's funny that a lot of hospitals don't have an endocrinology sort of practitioner. Maybe they don't have they don't do inpatient endocrinology consults, and it's kind of a thing. There are not that many emergency endocrinology conditions. Maybe one only exception is maybe when the thyroid or adrenal is completely shot. It doesn't happen that often, though. We don't see it that much in the hospital. But I would say that maybe everybody with a chronic disease needs an endocrinologist. Okay? Why? Because chronic fatigue, right? We're talking about obesity, or even people who are dealing with in elderly populations with underweight status, right? And that can affect bones. Maybe the one benefit to obesity is that you're less likely to have bad osteoporosis. If you're an 80-year-old woman and you're overweight, your bones are actually going to be better off than if you are underweight at 80. So there are so many applications for endocrinology. even in the primary care setting. In fact, I think that all primary care doctors should be trained in endocrinology, and take it beyond just the thyroid. It's like the people think that the thyroid's the only endocrine condition. I use endocrine treatments to treat dementia. I use endocrine treatments to treat chronic fatigue, fibromyalgia, chronic pain, and there's evidence behind all of this. So again, this is sort of an integrative approach to understanding the human body. I would call a non-integrative doctor a disintegrated doctor. Doesn't understand how all these different systems are connected, okay? And sometimes if you are hyper-specialized in your thing, you don't see the human, or you don't see the integration of the different elements of the body. That's dangerous, okay? And as a doctor gets older, they are higher risk to populations, which means that we have to stay current, we have to stay educating ourselves. You know, if I had known 10 years ago that I would find antibiotic-resistant bacteria in 100% of Americans that I see, 10 patients a day getting their stools checked for antibiotic-resistant bacteria, 100% finding antibiotic-resistant bacteria in these people. And I'm connecting the presence of these altered microbes in their gut to chronic conditions. Now, this is the cutting edge of understanding chronic disease. Every chronic disease is connected back to your gut. And maybe your grandmothers may have told you, you know, that how to eat and so on. We all have that implicit knowledge, right, about our gut. Even if you are skeptical towards anything holistic, you gotta know deep down that your gut matters in your health, right? Now we have the science for it, and it's all measurable, right? If you're thinking this way, you don't really need risk assessment scores in advance. I can probably assess all of your risks in this room right now, okay, just based on watching you walk, all right? It becomes automatic. Yesterday at one of the breakout sessions, I was talking to one of you, and I was giving some free medical advice after being asked, and I just noticed, yeah, I was like generating all this information about him just unconsciously, just based on the way he walked. So we need to understand that the medical system, the way it is, like I said before, it's disintegrated, and it's changing. It's changing for the better. There are more and more doctors, I'd say under age 50, who are going to be probably more likely to understand your value, and because they're looking at innovation. They're looking at building their practice. They're looking at how to achieve more value, achieve more quality with less work. Just based on the system that I've created, I'm now able to see double the amount of patients I see with less stress, and I'm still hanging out with my 5-year-old at 5 p.m. every day, right? I'm like at the least stressed out in my career, and I'm doing more. So that's because of the partnerships I make with people like you, and how to understand how to deliver care now in this time. We have a chronic disease epidemic that is sinister. It's awful, and we're all contributing to becoming the solution. That's the win-win formula.
Going back to what you were mentioning about, so I've been in this business a very long time, and I have old habits that I catch myself doing, and I realize I get corrected when I speak to a young person coming into this industry. There's so much innovative technology, so many other resources. If you're not tech savvy, get support on that, because I'm demanded on reports to the even chronic condition reporting. I have really tight partnerships with the IPAs. Whoever's asking me and demanding data analysis, I do that. And if I can't get to that level, I bring somebody on board that helps us support that. There's the amount of, I don't know what's the new generation, but the amount of innovation that's coming in today's innovation, with the amount of internet exposure plus education and the things that they're learning today and they're sharing is unbelievable. So you constantly have to challenge yourself and get to know what's going on, not only in healthcare, but in the financial world as well. There's a lot of things, and that's why we partner. We're a Spark partner also. Syndicated Insurance Agency, 23 years, and we're partnering with this new company that started, how many years? 2 years or 3 years now? Two. And it's unbelievable. In 2 years, the amount of innovation that they're bringing to the table. It's you know, I thought I had it up there, but they're challenging us to bring in even more, another level of expertise that we didn't know what was out there. So just challenge yourself, always question yourself, and be open to criticism, because that criticism can help develop you so well. And it's always good to listen. In the old days, you tell, oh, listen to your elders. Yeah, that's our patience. Listen to the young people that can educate us a little more, because I'm there. So listen to, be open. Listen, hear, educate yourself. Google's great, so Google something if you're not sure of what's out there. But you know, we're getting close to closing, but I wanted to get to our industry. Vanessa, why do we do what we do? Why do we speak in public? Why do we share what we do? Maybe you can say
Sure, thank you. Well, as you can tell, I don't like to speak in public, but I definitely love what I do. I love working with seniors. I love doing the right thing. I really genuinely feel like I'm helping someone. And I have a grandmother, you know, I have two actually, thankfully. And I want to make sure that they're getting the right service, right? The right consultation to get onto the right Medicare Advantage plan for them. So just basically being ethical, compliant, and just really being passionate about what you do.
Absolutely. And Dr. DV?
I think that we need to stay with this innovation concept, like never feel comfortable that what we're doing is enough. I mean, not to make ourselves feel paranoid or anxious, but it can be improved, right? The system can be improved. The way we're contributing to the system can be improved. And that all that requires, in my opinion, is a attitude of learning, a humility towards learning at all times. I learn from my patients, I learn from my kids, I learn from people like Jason and Vanessa, I learn from all of you. Every interaction you have, there's an opportunity to learn. And then if your mind is receptive like that, right, then you listen more, and there's gonna be solutions that are just gonna happen for you. That's the way the human mind works, right? Consciousness is a profoundly amazing thing. And allowing it to do its thing, listening, being open to innovative new ideas, you're gonna be better. You're gonna be contributing, uplifting the lives of more people. And you know what? A great side effect of that is making some money.
Yeah, this is a very rewarding career. I've been doing it because it takes just a little grain of extra salt to make things happen. So you're in a position that you can save many lives. You can provide quality of care. You just have to be interested in the changing world. Healthcare is never the same every year. Every year there's something new, something innovative. Just keep yourself informed of all the things that are happening. There's major acquisitions happening all over the place between every insurance company. What is that going to do? Major medical groups acquiring other medical groups. So there's two ways to grow. You can do organic growth, which is what we're talking about today, which is one patient at a time, one soul at a time. So remember, this is a business of people. Or you have a big duffel bag with a lot of cash, and you can buy anything out, and you'll grow just as fast. So approach things that way, one person at a time, and it's all about humanity. And I don't think a lot of folks use the app, so I'm going to give a quick few minutes. If anybody wanted to ask a question, we have a few minutes here. Oh, go ahead.
I tried the app.
Yeah, it doesn't look like it's working.
This is a really interesting collaboration or partnership between clinician, Optum, and an agency kind of like yourself. I'd love to know, how did this begin?
Oh.
how did this begin, and your thoughts on whether it is replicable and scalable?
Yeah, so we all linked up by professional partnerships. I do a lot of advertising on television, YouTube, radio, and I'm always looking for dynamic speakers. And I was talking to an executive that said, you know what, there's this doctor that would be great for the show that you're having that's coming up, right? And we did some YouTubing, and we did a couple of radio shows and things, and we just became really good friends. And I said, we were just a good match. It's just two people talking, and we know each other's families, we go to each other's homes, so we just built that camaraderie. And out of all the providers I work with, one of my favorites, but I have, multiple relationships that are that tight. Just came back from Palm Springs because a physician got a nice bonus because we helped them with their health risk assessments and their RAF scores and their HEDIS and all that. Treated me to a nice little weekend in Palm Springs, and I just got back from that. So it's, again, one relationship at a time. There's no formula. A lot of, it's funny how many executives try to just stick to, like, okay, we're gonna plug a table at a clinic and see how many enrollments you get. What we do with our physicians, I don't even do one enrollment for him. What I do is I have a whole team of agents that support enrollments for his office. He just did a doc talk yesterday, right? And we had two of my agents at the doc talk. I'm not there, but we have, and my agents don't compete with each other because we have so much volume of leads that are coming in that they don't mind if they're not fighting for the same enrollment because we have just so many providers to serve, but we don't burn out the agent. We have the entire agency supporting each one of my contacts. So it's a whole team effort that's really working for our agency. And that's the partnership. And then with Vanessa, we had a really good relationship. So I know a lot of the directors and all of the top executives at Optum, but it took one of the supervisors at Optum to introduce us as the IPA manager. And again, she has the same passion, the same values, the same things I have, and that built that relationship, and that's how we connected. So
I think it is
one person at a
scalable.
time.
It is scalable because for me, it was a learning curve to understand how IPAs work and about a volume-based thing because, I said before, 90-minute consults, right? So how do I do a volume-based managed Medi-Cal or managed Medicare? How do I include that? I had to learn how to include it in my practice so that I took over a small practice that was, a guy was retiring, and the guy had about 500 managed patients. And so that started my discussions in my head about IPA and how to connect with that. So I started to understand how volume and it was a learning curve, and it's just like dominoes. One thing led to another, and thanks to Jason, I got scored a few more contracts. So we have an endocrinology contract with a major IPA, and so it just led to a lot of growth. And then, so I think it's scalable because doctors doctors go to conferences to learn about how to grow their business. They do it in clinical. They focus on the clinical aspect, thinking that if they have more clinical skills, that'll lead to more billing, and that can lead to more marketing revenue, and then that can, marketing budget, which can lead to more volume. But understanding the systems and how a system like a managed Medicare population can serve your practice. That's something that can be learned. It's new, but there's a need for that because there's so many disgruntled internal medicine and family practice doctors coming out of training with, it's kind of like a bleak professional life. It's 35 patients a day at Kaiser, or do what I did, which is like refuse to be part of the system and carve my own way and find how an IPA fits into my practice, how managed patients fit in my practice, how my concierge fits into my practice. So the whole thing sort of serves my practice. I'm not like necessarily, I don't want, it's just not my style. I don't think it's a lot of doctors' style to want to be a cog in a machine. So there are all these like smart, young doctors looking for novel ways of running their business, and which is why I consult for them. So this is a scalable thing because doctors are so used to thinking you work and you make money based on your work, but you can, if you're smarter, you can work a little bit less, help more people, and like I said, the side effect is the money, and it's so rewarding. When you reverse diabetes, or all the cases we have of, I speak at medical conferences about disease reversal, the cases we have, lupus reversal, diabetes reversal, I have a sarcoidosis referral. All these weird diseases reversed by getting to the underlying cause. And that's so fun. It's so amazing. Makes me so breathtakingly alive to do that kind of work. And so how do you do what you want to do and have a career where the money's coming in? You have to be strategic. You have to learn about these kind of relationships. Like I said, 10 years ago, I was thinking about not even taking insurance, and it's a learning curve. But I can teach young doctors who are thinking like this, and I have a friend, actually a former partner, who quit practicing medicine to form an IPA. Right? So there are enterprising, and then he went to do MBA and all that, but there are enterprising doctors that, or at least enterprising in their thinking, you just don't know how to do it. So it is definitely scalable.
Yeah.
Doctors are used to thinking that they can
So
work.
We're a little bit over time,
Okay. Yeah.
but we're going to be around, so we're not leaving. So if anybody has any further questions, we'll hang out for a bit. Thank you.
Thank you.